Hi, I'm Tamari Mitchell, and this is my week 6 lab video. Before we get too in depth with this video, we'll start out by touching base on the previous video that I uploaded, my week 5, because I noticed that I didn't announce what lobe I was in when I was listening to his lateral lung sound. So we'll kick this video off with that, and then we'll get into the week 6.
I'm Quinta Rex, and I give her permission to record.
All right. Using the diaphragm side of the stethoscope, we will listen. So this is his left side. So it'll be left upper lobe and then left lower lobe. And then on the right side, you'll have 3 parts because the right side has 3 parts of the lobe. So you'll have right upper lobe, right middle lobe, and right lower lobe. Cool. All right. Thank you. And then now we'll get into our week 6 lab video.
Come in.
I'm performing hand hygiene, putting on my gloves. Hello, Mr. Banks. How are you?
Good. How are you?
Good. I'm doing good. Thank you for asking. I'm Tamari Mitchell. I'm a student nurse at Chamberlain University, and today we'll be performing another assessment on you. So this time the assessment will be the neck vessels in your neck, and as well as cardiac. You're just checking out your heart. And it'll take approximately 5 to 6 minutes. Is that okay?
Yes.
Alrighty. So we'll start off with some cardiac questions. Have you had any history of heart diseases or anything like that?
No.
No? Any chest pain? Past heart stents placed or anything like that?
No.
No? Okay, good. Alright, so the first thing we'll assess is his jugular vein. If we were in a hospital or assessment setting or if we were in a doctor's office, I would have a actual bed where I could adjust the positioning. So when you check the jugular vein, what we would do is put him on a bed and have him lay supine at 45-degree angle, and I would have him turn his head towards the left, and I would check his vein right along here on his neck. And so what we want is for the vein to be flat. We wouldn't want it to be bulging. That would show signs of increased pressure, which we do not want. And so we would just assume that his is flat and he passed the test in this circumstance. Next, we'll listen and we'll palpitate and listen to his carotid arteries. So when you palpitate, you never palpitate at the same time, just one at a time. And what we'll listen for is for his pulse to be on a grade of 2+, and as well as for it to be smooth and strong. So locate his pulse and list a feel. Yep. Yep, and I felt on both sides, and they are 2+ on both sides, as well as strong and smooth. So next we'll listen to his carotid arteries. With that, we will use the Bell side of the stethoscope. And what we'll be listening for is any sounds of bruit, which is a whooshing sound. So when I have him, when I'm listening to his carotid artery, I'll have him take a deep breath in, out, and then hold. So take a deep breath in, out, hold. Deep breath in, out, hold. Okay. So all I heard was his pulse, which is good. We don't want to hear any whooshing or any such things like that. So that's good. That's all I heard. Next thing we'll do is we'll move down to his heart region and we'll check out his pericardium. So what we'll do is look for any type of pulsations or abnormal movement. So I look and I observe, and the only movement he's doing is regular respirations, which is normal, and that's what we want to see. So we're good on that end. And then next we'll check the point of maximal impulse, which is located at 5th intercostal midclavicular line. So midclavicular line, and then 5th intercostal, so you'll count. So I always start from the clavicle and count down, just to find the 5th intercostal. Okay, so yours is kind of here. Okay. And what we're doing is looking for his pulse, and same scale, 2+, strong and smooth, which I found, and it is. Okay, so good. So next what we'll do is also take his heart, and then we'll get him out of here. So the first thing we'll do is we'll listen to it with using the diaphragm side of the stethoscope. And what we'll be auscultating for is just listening for his pulse. What we do want to be on the lookout for is any signs of click or abnormal sounds, such as like a heart murmur. So first, we'll check out the aortic area, which is on the right side, second intercostal, and right side of sternal border. Then we'll listen to the pulmonic area, which is right across, so it's second intercostal, left of the sternal border, sorry. Cool. And then we'll listen to Erb's point, which is right, just move right down. So it's third intercostal, so it'll be kind of right here. Third intercostal, left of the sternal border. And then we'll move down again, 2 down, to the fifth intercostal space, left sternal border, and this is the tricuspid area. And then we'll move slightly over to the fifth intercostal, left mid-clavicular area, and this is the mitral area. All right, so I didn't hear anything abnormal. Just to do a closer look, we'll listen to it with the bell side of the stethoscope. That way we can hear smaller sounds. So we'll just go hit the same points again. So it'll be second intercostal space, left or right sternal border, and that's the aortic area. And then we'll move right over to the pulmonic, which is second intercostal, left sternal border. And Erb's point, which is just 1 down, third intercostal, left sternal border. And then we'll move 2 down to fifth intercostal, left sternal border, just tricuspid area. And then we'll move a little bit to the left, fifth intercostal, left mid-clavicular area, which is the mitral area. And again, I did not hear any signs of heart murmur or clicks or any abnormal cardiac sounds. I just heard a pulse. So that means that he's in good shape. His assessment went well. So thank you, Mr. Banks.
You're welcome.
Thank you. And I thank you guys for watching.
Bye.